Hello, Scott. How are you doing today?
I'm doing great, doctor.
I'm glad to hear that. So I understand you just recently moved to Chicago for work and you are now here so you can be a new patient of my practice.
That's right. I was living in Florida, but moved to Chicago about a month ago for work. I've been trying to set up my appointment with a primary care physician, and my insurance recommended me to contact you.
I'm glad to hear that. Well, since you are a new patient of mine, I will have to ask you a series of questions to make sure I have all the information I need. We will also do some lab work so I have all of your updated labs.
That sounds great.
Okay. So I know you are from Florida and moved here for work. What do you do for a living?
I am an investment analyst consultant.
Oh, that's interesting. Okay, why don't you tell me more about your previous medical history? Have you ever been diagnosed for an illness or disease?
Yes, doctor. I have diabetes. I'm on insulin daily.
Okay, so you are a type 2 diabetic. What insulin are you currently taking?
I am on Lantus 19 units every morning.
Okay. I will order a CMP to see how your sugars have been doing lately. Do you have any other conditions I should know about?
I have asthma. I use an albuterol inhaler as needed. Usually I only use my inhaler during the spring season.
Okay. So aside from the inhaler and the insulin, what other medications are you on?
I take Xanax 5 milligrams as needed for my anxiety. I've been actually taking it more often daily, because with all the moving and new job situation I have felt more anxious than normal.
Okay, and what about previous surgeries?
I had my appendix and gallbladder taken out. I also had my tonsils removed as a kid. Aside from that, I can't think of anything else.
Do you drink, smoke, or do any illegal drugs?
I do. Just on occasion. However, I do use marijuana daily.
Okay. I will add a CBC and urinalysis to your lab work. Now please let me examine you. Take a deep breath in and out. Do you have any complaints I should be addressing today?
No, doctor. I feel fine.
Great. Your exam is normal. However, your blood pressure was a bit high this morning. It was 140/100. Do you know what your usual blood pressure numbers are?
No, doctor. I am not sure. But I've never had a problem with that.
Okay. Well, I will need for you to buy a blood pressure cuff and to take your readings every morning before breakfast. Please write them down, and I will follow up with you in 3 weeks. I also would like to refer you to an endocrinologist to discuss your diabetes. The OcuCheck showed your glucose to be at 150 this morning, but I want to make sure the endocrinologist would like you to continue on Lantus.
I understand. I also wanted to ask you if you could please give me a flu shot. Everyone at work is getting sick, and I can't afford to get sick as well.
Absolutely. I will give you a flu shot today. Do you have any other questions or issues you would like me to address today? Anything I should be aware of?
No, doctor. I think that's all. I will buy the blood pressure reader and follow up with the endocrinologist this week.
Sounds good. Have a great rest of your day. I will see you in 3 weeks.